The causes of this reduced activity can be classified into two types: the chronic conditions and impairments. The chronic conditions are systematic health problems that persist longer than 3 months, such as hypertension, arthritis, heart disease, diabetes, and emphysema. While not all chronic conditions are life-threatening, there are a substantial burden on the health and economic status of individuals, their families, and the nation as a whole. The actual number of chronic conditions increases with age. Therefore, limitations from activities become increasingly prevalent with age. In 2001, about 35% of elders reported a limitation of activity due to chronic conditions. Furthermore, many chronic conditions can result in impairments such as the loss of sight from diabetes. Chronic conditions of elders vary by gender and race. More men experience life-threatening acute illnesses, example, heart disease and hypertension-induced stroke, while more women experience physically limiting chronic illnesses such as osteoporosis and arthritis. Impairments are deficit in functioning of one's sense organs or limitation in one's mobility or range of motion. Like chronic condition, impairments are far more prevalent in older elders. The four primary impairments are hearing impairments, orthopedic impairments, cataracts, and other visual impairments. Another impairment of great concern is memory impairment. Memory skills are important to general cognitive functioning and declining scores on tests. Memory are indicators of general cognitive loss for older adults. Low cognitive functioning, example, memory impairment, is a major risk factor for entering a nursing home. Like race for chronic condition, rates for impairment that differ from gender and race. But unlike chronic condition, impairments are affected by two other variables: the previous income level and our previous occupational exposure. Health behaviors and lifestyle choices. In interviews, elders generally report more favorable health behaviors than their younger counterparts. They are less likely to consume large amounts of alcohol, smoke cigarettes, be overweight or obese. However, it should be noted that many of those who abuse alcoholic beverages, smoke cigarettes, and were overweight or obese died before 65 years old. The health behaviors that can impact the health of elders the most are the healthy eating, exercise, and immunization. Healthy eating plays a major role in preventing or delaying the onset of chronic diseases. The dietary quality habits of elders are better than their younger counterparts. The 1996 Surgeon General's report on physical activity and health reported that inactivity increased with age. While a substantial majority of adults at all age levels did not achieve the recommended level of physical activity, the number of sedentary persons, those who engage in no discretionary physical activity at all, increased with age. By the age of 75 years old, about 1 in 3 men and 1 in 2 women engage in the dangerous practice of inactivity, twice as fast as a normal pace for at least 30 minutes a day. Most days of the week is almost as beneficial for reducing the death rates as jogging up to 40 miles a week. Walking 4 hours per week decreases the risk of future hospitalization for cardiovascular disease. Brisk walking 3 hours a week reduces the incidence of coronary events between 30% and 40%. Through aerobic conditioning has been considered the exercise of choice for improved cardiorespiratory functions. Other forms of exercise have proved beneficial as well. Tai Chi and resistance exercise, for example, provide cardiorespiratory benefits. Resistance exercise, in fact, appears to reduce blood pressure level and cholesterol level. Most people do not think of elders when they hear the word immunization. But for adults, especially those 65 years old and older, getting immunized against certain diseases is important and can prevent thousands of deaths each year. As noted earlier in the chapter, influenza and pneumonia are the 5th leading cause of deaths in the elders. Vaccination against these diseases are recommended for elders, especially those who are increased risk for complication from influenza and pneumonia. Influenza vaccination are given annually, while pneumonia vaccination are usually given once in a lifetime, with possible revaccination with severe comorbidity after 5 years. Instrumental needs of elders. Six instrumental needs that determine lifestyles for people of all ages. These are income, housing, personal care, healthcare, transportation, and community facilities and services. However, the aging process can alter these needs in unpredictable ways. While those elders in the young old group, 65 to 74 years old, usually do not experience appreciable changes in their lifestyles relative to the six needs. Elders in the old group of 75 to 84 years old and the oldest old group, age 85 and older, eventually do. Elder abuse and neglect. Reporters of elder abuse and neglect have increased greatly in recent years. According to the first ever National Elder Abuse Incident Study released in 1998, an estimated total of 551,000 elderly persons over the age 60 had experienced abuse, like physical, emotional, and psychological. Neglect or self-neglect in a domestic setting. Female elders are abused at a higher rate than men. Elders 80 years old and older are abused or neglected at 2 to 3 times the rate of their proportion of the elderly population. In almost 90% of all elder abuse and neglect incidents where a perpetrator is identified. The perpetrator is a family member and two-thirds of the perpetrator are adult children or spouses. Victims of self-neglect are usually depressed, confused, or extremely frail. Income. The need for income continues throughout one's life. Achieving elder status often reduces the income needs. Perhaps the major reduction occurs when one's retirement. Retirees do not need to purchase job-related items such as special clothing or tools, pay union dues, or join professional associations. Expenses are further reduced because retirees no longer commute every day, buy as many meals away from home, or spend money on business travel. Reaching elder status also usually means that children are grown and no longer dependent. There are 5 sources of income for elders. First is Social Security pension. Example, government employee pension, private pensions. Second is the earnings from jobs. Next is income from asset. Example, saving accounts, stock, bonds, real estate, etc. And other miscellaneous sources. Example, public assistance for the poor elders. Social Security benefits account for about 2/5 of income for elders, and asset income, pensions, and personal earnings each provide about 1/5 of total income. Yet, Social Security payments are the modest. In 2004, the average monthly Social Security payment to retired individuals was $843. This amount to an average of $10,000 per year. The elders who rely most heavily on Social Security income are the poorest. Housing, a basic necessity for all, is a central concern for elders in terms of needs and costs. It is an important source for elders. A home is more than just a place to live. It is a symbol of independence, a place for family gatherings, a source of pleasant memories, and a link to friends, the neighborhood, and the community. Housing for the elderly is examined. 4 major needs are discussed. They include appropriateness, accessibility, adequacy, and affordability. These needs are not independent of each other. In fact, they are closely intertwined. Elders may live at affordable housing, but the housing may not be appropriate for their special needs. Or certain housing may be accessible to the elderly, but it may not be affordable to elders, or may not be an adequate number available to meet the demand. The relocation of elders is not always traumatic or done against their will. Many elders are finding housing in communities that have been planned as retirement communities. Retirement communities usually offer a variety of housing alternative ranging from home or condominium ownership to apartment living. Because these communities are developed to meet the needs of elders, special accommodations are usually made for socializing, recreation, shopping, transportation, and selected educational programs. In recent years, there have been a number of new housing options of elders. Two of these include Continuing Care Retirement Communities or CCRC and Assisted Living Residence. CCRC currently the residents, a lifelong residence and healthcare. They work in the following way. The retires either for case or term lease or sometimes lifelong, a living unit on a campus-like setting. The living unit could be a single-family dwelling, an apartment, or a room, as in a nursing home. In addition to the living units, the campus usually includes a health clinic and often either a nursing home or health care center. These other facilities are available to the residents for the additional fee. Residents of CCRC can live independently. Residents of the CCRC can live as independently as they wish but have available to them a variety of services, including housekeeping, meals, transportation, organized recreational and social activities, healthcare, and security. Many living units are equipped with emergency call buttons.